Hi, everyone, and welcome to episode 76 of the Pet Behavior Chat. And today we're going to talk about choosing your psychopharmacology patient. So we're kind of diving a little bit further into the world of psychopharmacology, also known as behavior medications or psychotropic or psychoactive medications. And today I want to chat a little bit about how do we know who would be an appropriate patient for behavior meds. So what are the kind of things that we're looking for? What are the presentations that we think behavior medications might be useful for? And what are the kind of circumstances also that we're thinking about? So I'm going to take you through a little bit of a checklist of the types of patients that I think about when I'm thinking about behavior medications. And I hope it will give you a good structure to think about for your patients as well. All right, so the first group of patients that I think of are the ones that are presenting with fears, phobias, anxiety states. So that could be generalized anxiety or anxiety in certain settings. So when we talk about generalized, we think about at least 3 different contexts. So if the patient is anxious or fearful in at least 3 different situations or 3 different contexts, that's when we start to think about generalized or global, or when we start to think about terming it or diagnosing it in that way. So fears, phobias, anxiety states, but also panic. So those pets that perhaps have those moments of panic during separation anxiety, that would be a panic presentation. Stress, so patients that present with increased levels or chronic amounts of stress in their lives. And then also conflict, so conflicted emotional states where they might be motivated to do 2 different things at the same time. And oftentimes we think about conflict, especially in social relationships. So that could be social relationship with a caregiver or social relationships perhaps with other pets in the home. So those are sort of your classic, I guess, mental and emotional ill health states. So fears, phobias, anxiety states, panic, stress, and conflict. So that's usually the first thing I think about is, when I'm thinking about patients that might be good candidates for psychotropic medications, they might fit into this category. The next category that I might think about are patients that are showing either high levels of arousal. So we're talking about emotional arousal here, not necessarily sexual arousal. That could be part of it, but emotional arousal, high levels of reactivity and perhaps impulsivity. So those terms might be a little bit abstract, but we're thinking about kind of latency to behavior. So how quickly would they react, respond? How impulsively would they react and respond? So what maybe is the intensity like? And, do they find themselves in high levels or experiencing high levels of arousal for prolonged periods of time? So this is all about kind of, I guess, time to behavior, intensity of behavior, maybe also that kind of frequency or duration piece, that level of intensity. So those might be things that I might also think about when I'm thinking about whether psychopharmacology would be useful for this patient. And then another group would be patients that are showing what we would perhaps term true pathological states. So that could be abnormal repetitive behaviors, also known as maybe compulsive behaviors, where we have complex pathology perhaps going on in the brain. That might also be something like cognitive dysfunction syndrome. So whether that's in dogs or cats, where we have kind of a neurodegenerative disease that shows true pathology on histology or even on functional MRI. So kind of more pathological states. And then I would also be thinking about psychopharmacology where I'm trying to support other physical disease. So maybe chronic pain, maybe neurological disease, maybe we have comorbidities such as anxiety and epilepsy together. So that's also somewhere where I would think about bringing psychopharmacology in. Where we do have maybe chronic pain or especially neuropathic pain, there are a number of different medications that would be appropriate for behavioral presentation and neuropathic pain presentation at the same time, or maybe neuropathic pain is influencing behavior. So we're thinking about psychopharmacology there. So those would be some of the groups of presentations, or the almost like the who, like who would I be looking at? What kind of presentation would I be thinking about if I'm thinking about reaching for psychopharmaceutical medications? And then we're potentially thinking about different contexts. So when would be an appropriate context that we might be thinking about psychopharmaceutical meds? So where welfare is compromised, and we're thinking here about the welfare of the patient, but maybe also the welfare of the caregiver, maybe where rehoming is on the cards, or even behavioral euthanasia is on the cards. So if we haven't already thought about psychopharmaceuticals for these patients, is that something that we could bring in to maybe change that, to improve welfare, to maybe be able to keep the pet in the home, to potentially maybe avoid behavioral euthanasia? Although, you know, if behavioral euthanasia is indicated for safety reasons or for other reasons of welfare, quality of life, then, you know, maybe that's not a consideration. So we're always thinking about contextual care here. You know, what is the context like, and can we, with psychopharmaceutical medications, make a big enough difference that it's actually going to have a positive effect on welfare, being able to keep the pet in the home, not having to euthanize the pet, quality of life, wellness, well-being, all those things. And again, we're thinking about the patient and the caregiver here. A second context that I might consider is where behavior modification or training alone are unlikely to improve the animal's behavior. So in many instances, you know, a great use of behavior modification and training, you know, can be massively valuable in changing that pet's behavior and maybe also their emotional state. But we do have a number of cases where training alone is unlikely to do that. And I often hear clients, in fact, I just hopped off a consultation with a client, with an initial consultation with a client just now, who said to me she had spent a huge amount of money on training for her dog, and just nothing helped. And the reason that nothing helped is because we have a mental and emotional ill health disorder, which is underlying everything. So this little doggy is severely anxious, severely fearful. And until we get on top of that emotional arousal and that kind of heightened emotional state, it's unlikely that that dog is going to be able to learn different responses, more appropriate responses, because they're living in this kind of limbic overload, or kind of limbic hijack, it's also sometimes referred as, where basically the animal responds from a place of needing to survive, wanting to survive, fight, flight, limbic overdrive, and is going to be finding it really difficult for those cognitive areas of the brain to be able to come in to learn appropriate responses. So sometimes we also kind of refer to it as medication being able to open the door then for behavior modification and training to come in secondarily. But yeah, where trainers sometimes, or even pet owners, pet caregivers tell me they've kind of, you know, hit a brick wall, or they've reached a kind of a ceiling where the training, the learning, the behavior modification isn't helping any further. That's where I might be thinking about bringing medication in to help open the door, open the window to that animal then being able to respond better to behavior modification. Another context that I might think about is where potentially it is difficult or dangerous to proceed without medication. So if we have aggressive behaviors, or if we have, and I'm going to come on to this point next, where we have perhaps self-injurious behaviors, where the animal is causing harm to themselves. So where it's going to be difficult or potentially even dangerous to proceed without medication, then obviously we're going to think about bringing medication in. And then that kind of leads nicely onto the next point, where it's potentially going to be harmful for the animal itself, or for others if we don't use behavior medications. Now, this always is a little bit of a tricky conversation, because I don't want anyone to think that behavior meds are the magic ticket and we can therefore disregard any kind of safety management. No, absolutely not. So if we do have a situation of an aggressive pet in the home, medication alone isn't going to be the thing that stops that aggression or stops those aggressive behaviors. We still always need to think about our safety management pieces, how we interact with that pet, what other kind of management pieces need to come in, what kind of behavior modification pieces need to come in. But again, oftentimes medication can be a really good adjunct here and can be something that can be supportive to bring down those arousal levels, to reduce that level of impulsivity and that level of reactivity, and is always part of a multimodal behavior plan. So that would be the next one, where it's harmful, where the patient, where it's harmful for others or even to the patient themselves. So where they are maybe showing self-injurious behaviors, maybe we've got an acral lick granuloma, or we have tail chasing that is resulting in self-mutilation or self-injurious behaviors. Maybe we have a cat that has true psychogenic alopecia and is over-grooming to the point where they're causing themselves harm. So harmful to self or others would be another category. And then finally, we might be thinking about choosing medications in situations where we want to help the animal cope with its environment. And this is always, again, a bit of a tricky one. So you can see choosing psychopharmaceuticals is not black and white, not straightforward. There is oftentimes a conversation to be had, a thought process to be had on our behalf and with the caregivers. So this helping the animal cope with the environment is a tricky thing to think about from an ethical standpoint, because surely if we provide an environment that is appropriate, that is suitable, that meets that animal's behavioral needs, then surely we don't need to come in with medications. And one of the areas that I really see this in commonly is in cases of intercat aggression. So where we have perhaps 2 or more cats living in the same home and their relationship is very tense, very hostile, very fractured, to the point where we have, a lot of stress in the home, and we have perhaps physical fights or maybe even non-physical. So these kind of passive aggression or covert aggression, sometimes it's also referred to. So the cats, both cats or all of the cats in this situation, are potentially not coping with that environment of a multi-cat home. However, we try to create a situation where we reduce the animal's arousal levels, impulsivity levels, maybe fear, anxiety levels, frustration levels, by using psychopharmaceuticals in order to better help them cope with that situation. And again, it is a tricky one, and it's a conversation I actually quite openly have with my clients. We either change the environment, the context, the situation, or we have to consider medication. And sometimes that's actually enough for some clients to think, well, I don't necessarily want to medicate my pet, so then the choice is to change the environment. And in a multi-cat home environment, that might be to rehome 1 or more of the cats, or to have a permanent separation solution if that's feasible and appropriate. But yeah, it's definitely a tricky situation. With dogs with separation anxiety, for example, if the environment or the context were able to be managed in a way where the dog was never left alone and the dog was always with somebody, luckily most dogs respond to having a warm body with them. Some dogs are very specific about the individual who they need to be with. In that case, yes, it does become very challenging. But if a dog is okay as long as they're with someone, anyone, then would it be a better option to manage the situation by making sure that the dog is always able to be with someone instead of maybe using medication? Now, sometimes these pets have a general level of anxiety where medications might be helpful anyways. But again, it's something to think about. is, do we opt to manage the environment to a point where the animal is able to cope and is happy and we don't need medication? Or if that's not an option, if that's not a possibility, is that then a situation where we need to think about coming in with medications? So as you can see, it's quite a lot to think about. It's a lot that we need to kind of mull over. There are a number of different factors that can be involved here. And sometimes, yes, we can maybe try and manage the environment. However, that animal's stress levels are now so chronic and so high that we still choose to opt for medication as well as management. So lots and lots of things to think about. And it comes with conversation, throwing ideas around, discussing ideas, looking where the comfort point of the caregiver is, looking at, where the level of emotional ill health and, where the context is at. And having those open conversations is going to help us to determine whether behavior medication, psychopharmaceutical medications are appropriate. Other things, obviously, that we're also going to think about is the individual. We're going to do a separate podcast episode on that. What are the constraints? What are the constraints in regard to the patient? What are the restraints in regards to the caregivers? What are the constraints from a legal perspective? What are the constraints from a medication themselves perspective? Like, what can we and can't we expect from meds? So that also needs to be factored in. There are other things that we also need to consider in terms of availability. What size of medication do we have? Do we have that medication always consistently available to us? So lots and lots of other things to factor in, but I'm going to save those all for another day. So I just really wanted to talk about the who's and the when's. So what are the patient presentations that we think about, and what are some of the contexts that we might think about when choosing behavior meds? So I hope you found that helpful. I hope that's helped you perhaps with some of the questions that you might need to ask yourself, ask from your patients, ask from your clients when you're thinking about whether medication might be a good fit for this patient. So these are certainly some of the things that I think about initially. There's a whole bunch more, which we will talk about in a separate podcast, but those are some of the thoughts to get started with. All right. I hope you've enjoyed that, and I look forward to seeing you next week for episode 77. Bye for now.